on the border of Thailand and eastern Burma, and everyone's on the move. Many are searching for employment, safety, and a better life. Today we're following just one of the many journeys of those crossing Burma to the border in search of healthcare. Some have been displaced by conflict and civil war, isolated in the mountains, or others who simply can't afford to pay to go to a hospital. I'll also be travelling to meet two very special women who run a clinic and healthcare fund for the displaced. But first, I'm about to meet one of the newest patients who has arrived from the border. This is Mon. He's a smiling, healthy baby boy. But only months ago, it was a very different story.
Okay, so what happened? According to mom, she gave birth to this healthy baby, but then with the little sacs of fluid at the base of his skull. And that sac seemed to get growing bigger, and the fluid just keep building up. This is the spinal fluid from his body. It keep building up, and it was getting a bit bigger than his head. The doctor told the mother that he needs surgery, but we cannot do it here, you have to go to Rangoon.
The trip would take over 7 hours on a bus and would cost more than what the family make in a month. This was Mon's life on the line, so they borrowed all the money they could. Mon and his mum travelled to Rangoon, but their efforts were wasted. On arrival, the doctor said they'd need to wait. The operation also wouldn't be for free. Unable to borrow any more money, they had no choice but to return home. Then on a whim, an aunt suggested they go to the Thai border to a clinic she'd heard about. Finally, they were ready to receive some good news.
We quickly refer Mon to Chiang Mai. We open up a space in the van because we transfer patient on a weekly basis. So Mon get to go and then receive surgery. And now he's growing boy, he's doing well, he's alert, yeah, and he's a happy boy. And mom looking after him well. He's a healthy baby. So yeah, that's the joy of our projects.
Mon is one of the lucky ones who made it to the border. But his story isn't unique. Kanchana sees hundreds of similar cases every year. In fact, there's been an increase since Burma opened up. But as for the highest cause of death for children in Burma, it isn't complications that require surgery, but rather very simple, preventable diseases.
So in the rural area, most of the children would die before the age of 5 because of poverty and lack of health care. So if their services is inside, why would they come here? Because they have tried. Many patients have tried to get treated in the country, but the system failed them. They cannot afford it. Yeah, or it's not available.
So I wanted to see for myself what the situation was like. What drove so many people to the border? What was the government doing to address these alarming health rates? So we decided to venture into eastern Burma. But it wasn't without its struggles. on our way we met some locals travelling by tractor to the nearest clinic. And before long, we spotted a modest house in the distance. We've just arrived in Tika Hall Clinic in Karen State. Now this is a rural area. It supplies 10 villages in the surrounding area who previously had no access to rural healthcare. This clinic was built thanks to international aid, but the local medics want help with medication and supplies. So Enye says villagers still desperately need vaccines and basic medication. Instead of listening to their pleas, the government has continued with their own plans, smacking down a massive new hospital, ignoring the small functioning clinic only kilometres away.
This hospital name is Dale.
When did it open?
Last year.
Last year. We meet the friendly young doctor who's been posted to the new hospital. He's eager to get to work, but is suffering a few setbacks.
Most of the patients, they not come to here regularly. They don't know about the hospital, and the most important thing in my hospital not have the electricity, so we cannot have the inpatient.
What do you mean there's no electricity? How do you run machines?
We use with the solar, but the hospital not have the enough. Solar is not enough in the hospital, so we cannot open the light in the night time. So it's not convenient for the patient.
Okay. Could we have a look inside?
Oh yes.
Yeah, let's have a look. It's very big.
Yes, hospital is big.
How many babies have you delivered here yet?
And here, patient not come to hospital for the delivery. Most of the patient they delivery in their village. The operation theater room, but they not support the instruments.
So you've got 2 surgery wards but no instruments.
Oh yes.
Has the government said when you will get equipment?
The government will provide later.
When?
Maybe later, and if it is in the project, I think.
So you're not sure when?
No, not sure. No.
Not sure.
Yes,
Okay.
we are waiting. We are expecting. Yes.
It's a great idea in theory, building new hospitals overnight. But without supplies and equipment, people continue to cross the border. One lady filling in the gaps is a person who's as famous as a rock star. Dr. Cynthia Mong is a big name on the border. She started a makeshift clinic 20 years ago that has now grown to the size of a small village.
The apocryphal story is that it was started in one room with a rice cooker to sterilize their medical instruments, which is a very lovely little picture.
From humble beginnings, Dr. Cynthia now runs a clinic that treats over 100,000 patients every year. She's calling for more investment in rural areas and for the government to work with existing community health services.
The health system is not like top-down. It should be community initiative and community empowerment.
To plan for the future, Dr. Cynthia has expanded Maytau's training program, investing in the next generation who will rebuild the health system.
Dito ya temu kone ita semula ne kapla mutini ke ko ye ke macagada pa kalumo ko me ke la pa kamla ko me ke no la ya te de pani ma ye ke macagada ne ta su ke te.
The dream of healthcare that people can access easily and for free will hopefully soon be a reality.